Hey folks, this is Mike Moore with Myers-Ziemke Insurance Agency, and I have the pleasure tonight of sitting with my star producer, Kim Moore, who manages the Life and Health Division at Myers-Ziemke Insurance. And she just recently put out a video about what people need to do or can do when they need health insurance before they turn 65, their spouse turned 65, and took Medicare, which I will be doing very soon. The video was very well put together, Kim, and I would like to compliment you on that.
Thank you.
I have a couple of questions I'd like to run by you.
Okay.
First off, when we talk about Obamacare, one of the primary benefits I see with that is the fact that there is no pre-existing involved, and secondly, that the rate is really based on three basic elements. Can you tell me a little bit more about that?
Right. It covers all pre-existing. It covers preventative care. There's no out-of-pocket cost for you for preventative care. And it's based on whether you're male or female, what county you live in, your age, and whether or not you use tobacco.
You know, and that is pretty nice. However, when you talked about the premiums for those, that was kind of like a wake-up call because it's not affordable. But it certainly is, and I would have to assume for somebody that has some major health conditions, that would be ideal for them.
Right. It's the right fit for some people, not for everybody.
And then the other plans that you talked about in there, they do have some medical underwriting involved with it.
Right. The next one is the enhanced choice one, and it does have some underwriting. It's not very strict, but you could get rated either up or down once you go through underwriting. It covers preventative care at 100%.
Which is very good.
Right. And then the deductibles are a little bit more reasonable as well. And the premiums are a little bit more affordable than, depending on your age, a little more affordable than Affordable Care Act.
Now, will the premium be based on my health condition? For example, if I'm really squeaky clean healthy, it'll be $300 a month, but if I got a heart condition, it might be $800 a month?
Correct. Like they have the quotes that I get are the standard quotes, but you could have a preferred price if you're super healthy, or you might have a substandard premium if you have pre-existing that is acceptable, but you're still, have a few things going on that they know they're going to have some expenses with you.
All right. That's good to hear. Now, and I've sold health insurance for a long time, even though I do not do it any longer by choice. Short-term health plans have been around forever. I've sold a ton of them, but it sounds like they've really evolved.
Yes, they have. Originally, these were plans that were developed so that if somebody was in between jobs and they had a 90-day wait or a 60-day wait before they got their employer coverage, that's what the short-term plans were for.
Exactly. That's how I sold them.
Now they are for 364 days. Some of them are 2-year renewable. So you'll get renewed at the new rate of your new age, okay? So now people are using these as their health insurance because there's no federal mandate out there now that's going to penalize you for having a short-term versus an Affordable Care Act.
That's really interesting. It really is. It has to be a little bit on the alarming side as far as pre-existing. But I suppose somebody that goes into the game with no past health histories,
right,
it would probably be the exact perfect option for them.
Exactly.
All right. So here's the thing. We have struggled with high deductibles, huge out-of-pocket expenses. Quite honestly, in my opinion, it would have to discourage some people from even buying a plan because just the out-of-pocket alone is going to bankrupt them. So what's the solution there?
Well, there's a plan out there called a plan enhancer, and you can add this onto any kind of health insurance plan. And what it's going to do is you're going to say, I want a $10,000 benefit, I want a $5,000 benefit, whatever it is. If you have an accident, break a leg, something like that, or if you get sick and are hospitalized, it's going to cut you that check.
So is that kind of similar to like that duck company?
Yes, it's very similar. It doesn't break it down to if you break your arm, you get $500. If you break your leg, you get $1,000. It's just a flat benefit.
That's pretty interesting.
Mm-hmm.
I kind of like that. Now, is that very expensive or?
No, it's very reasonable. Very reasonable.
Okay. All right. So we've all heard and we've received multiple phone calls from the car warranty companies. Companies we never heard from.
Mm-hmm.
I've always been, and the older I get, the more skeptical I am, but what kind of companies offer these plans? Are they creditable? Are they...
Oh, yeah. The one that is most popular for me is through National General.
I've heard of that company.
And they are affiliated with Aetna, Cigna, and actually Allstate now. And then Aetna has some plans. GTL, which is Guaranteed Trust in Life, Medico. There's several insurance companies that have been around for a long time that have these plans.
All right, so then prescriptions. It seems like, I know you had said some of your plans offer prescriptions, but prescriptions always seems to be a big gap in our coverages. What is the solution for that for people?
Well, if you choose a plan that doesn't have prescription coverage, and some of these plans, the prescription coverage really isn't that fantastic. Depends on what you're on. If it's an expensive prescription, then yeah, it might be a right fit. But there's all these discount programs that are out now, GoodRx or Single Care, and they have apps and everything, and you type in what your prescription is, and it's going to tell you what the pharmacies are in your area and what their price is with their discount, and they're free.
So it sounds like it's a little bit more maintenance, but if you do the due diligence, you can probably save some money on a prescription.
Oh, yeah.
And it's sort of, because I know when I go to the doctor, he always says what pharmacy you want to use because I'll send them the prescription. Kind of sounds like you need to go back to the written prescription so you can take them into whatever pharmacy, GoodRx, or whatever company says you need to go to.
Yeah, you can do that. Or the last time I went to the doctor and I got a prescription, I said, I don't have prescription coverage. I said, but I use GoodRx or Single Care, so she pulled it right up on her computer, and the doctor printed out the coupon for me and sent it over to the drug store that I said was the best price.
That's absolutely amazing. That's really good to know.
Yeah.
I'm going to use that. I didn't know it was available.
Good.
All right, let's talk about networks. Networks has always been one of the best things and one of the worst things that ever happened to health insurance because it seems like it's a revolving door with those companies. What do we have to worry about when it comes to HMOs and PPOs?
Okay. So HMOs, you have to use the providers in their network. You have to use doctors and hospitals, any place that you need medical services done. It has to be in their network or you do not have coverage unless it's an emergency. Okay. PPOs work a little differently. They have an in-network and an out-of-network. So you still need to use a provider they are okay with. But if they're not in the network, then you pay the out-of-network copay. So it might be a little bit higher, but you have more providers you can go to.
Now, is there, like in a PPO, is there any kind of forgiveness? What if you go, if you have an emergency, you go to a hospital that's not in the PPO, what happens there?
You're covered because it's an emergency, but as soon as you are out of that emergency status, you need to go to an in-network provider.
So I would have to assume that in the time frame when you're talking to a prospective client and you're asking them about their medical needs, their conditions, their prescriptions, who their primary care is, who their specialists are, where they want to go into a hospital, how does all that come together?
Well, I ask them all those questions. I have a form I fill out, and then when I'm looking at plans, I check those networks for them. And then I let them know. If there's a doctor that's not in the network, you can request them to get into the network, but there's no guarantee.
So it kind of sounds to me like it's pretty simple. I mean, my doctor is Dr. whom, and whatever. You just look it up on the internet and it's done. And it's not really a big job. I could do that myself, right?
You could.
So do you ever find situations when a doctor doesn't show up in the network and as you dig deeper?
Yes. Actually, it's kind of funny. Some of these doctors or providers might be so busy with their current clientele that they ask the insurance companies not to publish their name on the internet so that they're not getting new patient calls. So if that's the case, normally if a hospital is in the network and the doctor's affiliated with them, normally the doctor's in the network too, but sometimes they don't show up. So that's when I call the insurance company directly and say, is this just unpublished, or is he really not in the network? And then that's how I find out.
That's amazing. So I can look into it myself
Mm-hmm.
and not see it. You're able to have resources behind the scenes that can open up that door and find that.
Right, and find out.
All right. Lastly, very, very impressed with what you've done over the last several years to develop this division. Out of curiosity, I know you're certified. You have to be certified for multiple different things to be able to offer the products you have. The biggest certifications, time-wise, in my opinion, was with all the individual carriers. How many hours would you say that you have to do studying, testing, and certifications to be able to offer all the different plans that you can offer?
Well, I didn't really track it, but the individual health, I have to get certified for healthcare.gov every year. That's pretty simple now that I made it through the first time. So I really only have to study or learn about what's coming up for next year. This year I did my AHIP certification, which is for Medicare products. And that certification, probably to study for it, I probably spent 40 hours. And then I had the opportunity to take the test 3 times. You have to get 90% or better. And I passed it on my first try, thank God. And then once I did that for Medicare, you have to get certified with each insurance company you want to represent. So there was a lot of legwork because I had to see who was coming, who was in our area, who was going to have competitive plans, and then I had to certify with each one of those. And some of them could take 8 to 16 hours to get through theirs, and others took an hour or 2. So I didn't really track it, but I probably spent over 80 hours for sure, probably 120 hours just for the certification.
Now, is this going to be every year?
Uh-huh.
Yes. Kim, that's quite a commitment on your part to be able to help the people in our community.
Mm-hmm.
It means a lot to Myers-Ziemke. It means a lot to the people that need your help. The last thing I want to ask you about, and at Myers-Ziemke Insurance, Mike Moore, I've always said it's very important to recognize what you're good at, recognize what you're not good at. What you're not good at, you need to build a network around that is good at it.
Mm-hmm.
Now, I'm not going to say you're not good at anything. However, I am going to say the networks that we build to help support what we do is critical in this industry.
Absolutely.
What have you done in that aspect?
Well, for the most part, you know, I have passed all these certifications, so I know most of it myself. But then you have some oddball things that you don't come across all the time. And so I have aligned myself with a general agent that is in the Medicare field, and she is an absolute expert. I mean, I can text her all day long and say, is this what I'm supposed to do for this person or that? I mean, specific.
So is she 9 to 5? Or?
Oh, no, I text her at 10, 11 o'clock at night even sometimes, so on the weekends. She's awesome. And then I'm also aligned with a GA for the individual health aspect of it as well. Now, they're a little more 9 to 5-ish, but they're still very responsive. That's a little bit less year-round kind of thing because there's open enrollment for individual health. And then there's certain times that you are eligible to enroll in individual health, you know, for Affordable Care Act versus short-term or whatever. But during that busy time, they're very responsive.
That's good to know. And I cannot stress enough on any business success to be able to develop a network that guarantees or assures your success. So congratulations.
Yeah, and I've got a good relationship with all my marketing reps for all the carriers, too, so I can always fall back on them as well.
So, Kim, what's your cell phone number?
My cell phone number?
Yes.
I'm not giving you my cell phone number. If I meet with you, maybe I'll give you my cell phone number.
Okay. Fair enough. That is one thing that we do. At Myers-Ziemke Insurance, everybody knows our cell phone numbers.
Yes, it's on my card. So if I meet with you, you will have my cell phone number.
You can text us 24/7. We've always made the commitment that if we're watching a romantic movie or having a romantic dinner, we'll not respond. Other than that, we will do what we can do to help you.
Yes.
Kim, thank you very much for what you do. You do a phenomenal job. You're a rock star.
Thank you.